At your first visit, your doctor will discuss with you what the treatment is likely to involve, the benefits and risks, and any available alternative treatment. You will also need to give consent before you receive chemotherapy. To ensure you get the most out of your meetings and appointments with your doctors or nurses, think about bringing a list of questions or some points you wish to discuss and learn more about. This is particularly true for the first meetings before you become more used to your visits. Some helpful questions can include: what drug or drugs will I be given? Will I have to spend any time in hospital? Should I eat or drink anything before treatment? How often will I need treatment? Are there any long-term side effects? As with all treatments, it's important that you tell your healthcare professional treating you about any medications, including herbal treatments, that you are taking, as they can impact and interact with the type of chemotherapy medication you receive. Additionally, as there are constantly new therapies being developed which are tested in clinical trials or studies involving patients, it may be possible that you are also eligible to participate in these studies, and you may be offered the chance to take part. Depending on the clinical study, patients may get access to new therapies that are not yet available to the general public. You may ask your clinician if there are other studies open and if it would be beneficial for you to participate. Note, always ask your clinician what the potential risks are in participating in a clinical study. Taking notes about what your doctor says can be useful, and it is also worth considering bringing a friend or family member along to help remember key points raised by your doctor, as there may be a lot of information to take in at once. Do not feel embarrassed if you need to ask for information to be repeated. Your doctors and medical staff are there to see that you get the best care, and they will be expecting you to ask questions about your own treatment. You will be given a lot of information, booklets and leaflets, but you may also have questions when you are not in the unit or at an appointment. So ask your doctor or clinical nurse specialist for their contact information and also their preferred method of communication, so that you do not have to wait until the next appointment with them. It is vital that you know how to contact your medical team in an emergency. For example, if you think you may be getting an infection, you get a leak in one of your intravenous lines at home, or you have noticed a sudden deterioration in your condition. It is a good idea to share this information with your friends and close family so that they can contact the medical team on your behalf if for some reason you are not able to do so, or if they are particularly concerned about your condition. Hopefully you will not need to use these numbers, but it is always better to get appropriate treatment or reassuring advice than wait for things to get more serious in such circumstances.